Now let's go over the osteopathic technique of strain counterstrain. So the counterstrain CS, strain counterstrain. What the technique is it's going to utilize passive forces, meaning the patient is going to relax. They're not going to do anything. You're going to tell the patient, can I please have you relax for me? It's going to be an indirect technique, meaning you're not going to go into the barrier, you're going to go away from the barrier. And then tender points. A tender point is going to be a location on the body. There's going to be a whole bunch of tender points related to a lot of different levels of the body. You're going to find a tender point. One of the key points about these tender points are going to be there's no pain radiation. If I poke this tender point, it's going to be tender at the level of palpation, yet that tenderness will not radiate distally to any other area. So that's one differentiation between a tender point and a trigger point, for example. The technique that we're going to be using for strain counterstrain. Now, for strain counterstrain, what you're going to be doing is you're going to be finding these tender points. So first, you're going to find a tender point. That's going to be the very first time. You're going to palpate. You're going to place your finger on it. It will be painful to the patient, so don't push too hard, but you do want to palpate. So place your finger on that tender point. Next, what you're going to want to do is you're going to want to place that patient into a position of ease. This is where the passiveness comes in. You're going to tell the patient, relax for me. Position of ease. Typically, you're going to be shortening the muscle. So let's say I had a biceps tender point. What I would do is I would flex the bicep because I'm going to shorten the origin and insertion distance. I'd be shortening that muscle. So, for example, position of ease, depending on the tender point, there are some nuances. However, the general principle is you want to shorten whatever muscle the tender point is located within. You want to shorten the distance. So the position of ease. Next, you'll want to do is this position should diminish the pain. Now, the target goal is 70 to 100%, 75 to 100%. So pretty much 3/4 of that pain should be gone. So this position is determined if you take away that pain, if you take away 70% of that pain, then that position is good. Let's say the patient subjectively says, you know what, doc, it only feels 20% better. That position needs to be altered. You need to change that position because the tender point will still be there at the very end if you do not find that position. So once we've reduced the pain, so 70 to 100% decrease in pain, next what you'll need to do is you'll need to hold that position. The magic number is 90. 90, whatever examination you're going to be tested on, 90 is the magic number. So 90 seconds. You need to hold that position. You need to maintain this passive position for at least 90 seconds. Next, the last step is going to be return to neutral. But I want to emphasize, when you return the patient to neutral, you want to do it passively. You don't want that patient to help you because this is going to be involved in the resetting of this tender point, and that is going to be the basic technique.